It's easy to forget what a major advance it was to turn healthcare from something that you had to pay for, if you could afford it, into a public service that was there for everybody when you needed it.
I grew up wanting to be a doctor, just like my grandfather, and I was just so excited about the idea of being able to help people, but also to be able to work in a system like the NHS. In India, of course, patients have to pay for their care. He always found it really difficult to be faced with that situation where patients are having to choose between either feeding their family or giving their children life-saving treatment. And it always struck me that I am just so lucky that I do not have to make that decision day in, day out.
Mika had cardiomyopathy, which is basically a disease of the heart muscle. Last year he deteriorated quite rapidly. He needed a heart transplant. The NHS means everything to us, everything. They saved Mika's life. The doctors, the nurses, the surgeons, everyone involved in the NHS want to help so much, and we are so lucky. If it doesn't stay the way it is now, it's a very worrying situation for us as a family.
So the NHS is great, but it feels like something's not right. And more, it's not being run in the public interest.
To turn it back into a business for profit would not only be disastrous for us, but it makes no economic sense.
So why is this happening? The government puts a positive spin on everything, and the media have a really hard time getting to the truth.
That is exactly why we set up the Centre for Health and the Public Interest.
The CHPI are the only people who will reliably tell you what's happening with the NHS.
We are totally independent. We don't receive any corporate funding and we're not tied to any political party. Our work mainly consists of voluntary contributions from leading health policy academics.
We're a small team but a big network, and despite the few resources we have, we do punch well above our weight.
The Centre for Health and the Public Interest has gone through the accounts of these companies to identify just how much money...
Did you hear the story that over £1 billion is going to be leaving the NHS in profits to PFI companies over the next 5 years? That was us.
Dr. Goody Singh, you experience this and you see the evidence.
We don't just write for the public and to help them, we're also a trusted source for the BBC, the FT, the Guardian, the Daily Mail, and we reach ears across the political spectrum.
It's time for us to step up the fight against those who want the NHS to be gone.
We want to increase our output, but to do that we need your help.
Please support the work of the CHPI.
For an NHS for all of us.
Please donate now.
And then you go, yeah!